Come in quick! Something wrong with them, nurse.
Safety. Quickly assess the situation and check the area around the infant for potential hazards before approaching. Stimulate. Speak to the infant while approaching and clap your hands to act as a stimulus and alert others. Stabilise the head by placing one hand on the forehead and gently tickle the hands or feet. If there is no response, continue to assess and shout for help.
Juliet, can you just go and ring 999 for me now? Do want you to ask for an ambulance, but stay on the phone.
If help is available, ask someone to start dialing 999 and state unconscious infant whilst you continue to assess for breathing. If no breathing or agonal gasps only are noted, then ask the person making the phone call to state to the ambulance service that the infant is not breathing and give your location, for example Hillside Health Centre, Huddersfield, HD4 6DW.
The nurse, she says she's not breathing. Yeah, please come quickly. The address is 25 Green Lane, Halifax, HX3 5JD. Yeah, HX3 5JD.
Using a postcode will assist the ambulance service to find the location, but also advise of the location of a nearby community defibrillator if available. If there is no one available to contact the emergency services, the lone rescuer should perform 1 minute of basic life support before contacting the emergency services. This is achieved by counting the number of breaths delivered to 12. Airway. With one hand on the forehead and the tip of one finger of the other hand only on the centre of the jaw, place the head into a neutral position using a head tilt chin lift manoeuvre. Breathing. Look, listen and feel for breathing by placing the side of your cheek a few centimetres from the infant's face and look along the chest for no more than 10 seconds. If there is no breathing or infrequent gasps, then 5 rescue breaths should be given using a pocket mask with an appropriately sized mask which covers the mouth and nose. Place the mask over the nose and mouth, maintaining the neutral position, then gently breathe into the mask while looking for chest rise. As soon as the chest is seen to rise, stop the inflation and allow the chest to fall before the next breath is delivered. Take care when holding the mask not to obstruct the soft tissues around the jaw. Reassess for any signs of life. Circulation. Feel for a central pulse at the brachial or femoral artery in infants for no longer than 10 seconds, if there are no signs of life. If a heart rate is not detected or the rescuer is unsure, then immediately start chest compressions. Chest compressions are performed over the lower half of the chest, 1 finger breadth above the xiphisternum or tip of the breastbone, in a rate of 100 to 120 per minute. In infants, the necessary depth of compressions is 4 centimetres, and this can be achieved by placing 2 fingers on the sternum or by using the encircling technique if a second rescuer is present to assist, where the thumbs are placed side by side on the sternum while the rescuer stands at the side or foot of the infant and the rest of the hands wrap around the side of the chest and back. In a very small infant, the thumbs may be placed one on top of the other. 15 chest compressions should be delivered for every 2 breaths. Ventilation adequacy should be observed at every breath, as head movement during chest compressions can affect airway patency. Basic life support should continue whilst the ambulance personnel arrive or stopped if the infant shows signs of life, whereupon a reassessment of breathing adequacy should be made.